All right, today we're jumping into a topic that could honestly be the most important thing you ever learn: first aid. We're going to cut right to the chase and give you the clear, essential steps you need to know in a medical emergency. So let's dive in.
So, just imagine it for a second. An emergency happens right in front of you. Someone collapses, they're bleeding, maybe they can't breathe. What's your move? Look, it's a scenario we all hope we never have to face, right? But knowing what to do in that moment, well, it can literally save a life. And that's exactly what we're here to figure out. So, what is first aid, really? It's not about being a doctor or a paramedic. It's all about that initial assistance. You're the bridge between the incident and the ambulance. Your goals are actually pretty simple. Keep them alive, stop things from getting any worse, and kickstart that recovery process.
Okay, first up, we're tackling one of the most urgent emergencies you can face: when someone stops breathing. They call it asphyxia, but really, all you need to know is that every single second counts. And your number one job, right at the start, it's just to see the signs that it's happening.
So how can you tell? Well, the body gives off some pretty clear signals. You want to look for that bluish color on their face, lips, or even their fingernails. That is a classic sign they're not getting enough oxygen. When you see that, maybe along with some gasping or weakness, or if they're unconscious, those are your cues. It's time to act, and fast.
All right, let's walk through this, step by step. You get the person on their back. You check their mouth for anything blocking it. But now, pay attention to step 3, because this is absolutely the game changer. Tilting the head back. Why is that so important? Because that one simple motion actually pulls their tongue forward, away from the back of their throat, and boom, the airway is open. That's what lets the air you give them actually get in. Then it's just slow, steady breaths, about 1 every 5 seconds or so until help can take over.
Okay, so we've talked about breathing. Now let's switch gears to another really critical situation: serious bleeding. Just like before, the right actions taken immediately can make all the difference. The goal here is simple: stop the blood from leaving the body.
Now, before we get into the how, it really helps to know the what. Wounds are basically either open, where the skin is broken, or closed, kind of like a breeze, where the bleeding is happening under the skin. For first aid purposes, we're zeroing in on those open wounds, because you've got two big dangers at once: blood loss and, of course, infection.
This is the action plan, and I want you to notice the priority here. Number 1, before you even think about anything else, is pressure. You have to apply firm, direct pressure right onto the wound. Use a clean cloth, a t-shirt, whatever you've got. Everything else, covering it up, keeping it still, all of that comes after you've started controlling the bleeding. Pressure is job 1.
Let's move on and tackle two more really common but very different emergencies: burns and bites. And with these, knowing what not to do is often just as important as knowing what you should do. Okay, for burns, your two main goals are to cool the area down and then protect it from getting infected. If it's a chemical burn, that means you need to flush it with a whole lot of cool, running water. After that, you're going to cover the burn loosely with a clean towel. You don't want it tight. And hey, don't forget the human element here. Reassure them, keep them calm while you're getting them to a hospital.
Okay, everyone, this is so important. For snake bites, what you don't do is just as life-saving as what you do. So forget everything you've seen in old movies. Seriously, forget it. The reality is simple. Stay calm, call for help right away, and take off anything tight, like rings or watches, before the swelling starts. Now look at that don't list. No ice, don't cut the wound, and please do not try to suck out the venom. Doing any of those things can actually make the situation a whole lot worse.
So we've gone through some really specific skills, right? Breathing, bleeding, burns, and bites. But underneath all of that, there's a core mindset. This is the thing that guides you, even if you don't remember every single step, but you know you have to do something.
And really, it all boils down to this simple 3-part mantra. If you walk away with nothing else, remember this. First, stay calm. Panic doesn't help anyone. Second, call for help. Get the professionals on their way. And third, provide care to the best of your ability. Calm, call, care. That's it. That's your framework for pretty much any emergency.
And there you have it. Those are the absolute basics. We've walked through the key actions for some of the most critical situations you might face. Now you have the knowledge. So that just leaves one final question. When the time comes, are you ready to help?